ขึ้นฝั่งนู้นนะครับเหมือนกับว่าเป็น doorway information แล้วก็คือหมอขวัญเขาก็จะอ่านโจทย์ฝั่งนู้นปุ๊บเหมือนมันจะเหมือนจริงก็คืออ่าน doorway information เสร็จปุ๊บหมอขวัญเขาก็จะเขียน differential diagnosis ในใจแล้วก็ได้เขียนไว้แล้วก็คือก็จะเข้ามาคุยกับ SP ดูว่าจะทำอะไรต่อนะครับแล้วก็คืออันนี้จะเป็นลักษณะ observe ว่าดูว่าแบบจริงๆเนี่ยที่ต้องไปทำเนี่ยจะเป็นยังไงอันนี้ก็จะพยายามก็คือจะพยายามให้เหมือนจริงนะครับ แล้วก็จบจากข้อแรกเนี่ยก็จะถึงเวลาของในฟลอร์ครับเนื่องจากเป็นเวิร์กช็อปก็ต้องมีคนออกมาเป็นคุณหมอนะครับเพราะเรามีเตรียม SP ไว้หลายเคสเหมือนกันนะครับ
พี่ขออนุญาตออกตัวนิดนึงนะพี่ไม่ได้ซ้อมมานานแล้วนะ ถ้าเกิดว่ามีอะไรที่แบบว่าไม่ค่อยเวิร์กน้องก็อย่าทำเป็นตัวอย่างเนาะอย่าเอาเป็นตัวอย่างต่อไปคอมเมนต์ได้นะคะ
จะเปลี่ยนฝั่ง
ฮัลโหลได้ยินไหมเอ่ยโอเคเนาะเดี๋ยวนะคะพี่เขาจะช่วยจับเวลาเหมือนเวลาเราสอบจริงๆเนาะกิ่งแรกคือกิ่งที่มันจะเป็นกิ่งเริ่มเนาะแล้วก็อีกกิ่งหนึ่งจะเป็นเตือน5 นาทีก่อนหมดเวลานะคะแล้วกิ่งสุดท้ายก็จะเป็นหมดเวลาจริงๆเนาะเวลาที่เราสอบอยู่แล้วหมดเวลาจริงๆนะคะเขาจะเดินมาเปิดประตูเราจะต้องออกนะคะต้องไม่ชักช้ามากกว่านั้น
แรกไม่ต้องเร่งเวลาแต่ควันช่วยเร่งค่อยหน่อยแล้ว information
ค่ะก็อันนี้เป็น doorway information นะคะสิ่งที่เขาจะให้มาก็คือชื่อคนไข้เนาะอายุคนไข้ chief complaint นะคะแล้วก็ vital signs นะคะส่วนexamining task เนี่ยมันจะเหมือนกันทุกข้ออยู่แล้วอะค่ะคือว่ามันจะมีว่าโอเคให้ถามประเด็นที่สำคัญเกี่ยวกับประวัติแล้วก็ตรวจร่างกายที่สำคัญแล้วก็ดิสคัสกับคนไข้อย่างเงี้ยค่ะที่เราควรจะสนใจก็คือว่าชื่อคนไข้คืออะไรถ้าน้องควรจะจำไม่ได้พี่แนะนำว่าจดชื่อไปเลยเนาะอายุแล้วก็ไวท์ไซน์ที่อาจจะผิดปกติเพราะว่าน้องจะต้องเก็บเอามาไว้ใช้เขียนรีพอร์ตตอนจบอะค่ะ Good morning, Mr. Rook. I'm Dr. Kapuwat. Nice to meet you.
Nice to meet you, doctor.
I'll be your physician today.
Okay.
Please let me make you feel more comfortable.
Thank you, doctor.
Welcome. How may I help you today?
Doctor, I got a serious chest pain this morning.
Could you tell me more about that?
Is it a pressure-like pain, like a brick on my chest this morning?
Okay. Is it constant or does it come and go?
It is kind of constant pain. Yeah. Can you help me by giving me some painkiller medication?
Oh, I'm so sorry that you are in so much pain, but we have to go through some quick question and physical examination first, and then I will give you some painkillers or anything that make your pains better, okay?
Okay, doctor.
Okay, and how long does it last, your chest pain?
Maybe 45 minutes ago.
And can you tell me exactly where the pain is?
It's on my chest, on this area.
Is there anything makes you feel better?
When I lay on my bed, I think it's gonna better, but you know it's come again.
Oh, and is there anything make it worse?
I think when I walk and I walk upstairs to see you.
Is there any other symptoms like feeling sick in your stomach or sweating?
Yes, I feel nauseous and also spinning.
Okay. Could you please describe the pain for me?
It is a patient like, yeah, doctor.
Oh, yeah. And did the pain move anywhere else?
Yes, it moved to my left arm and my neck. Yeah.
Oh, and I'm going to ask you some question about your social life. Do you mind about that?
No, please, come on, doctor.
Okay. Do you drink alcohol?
Just occasionally.
Do you smoke?
Yes,
How much?
I do smoke 1 pack a day for more than 20 years.
Okay. Do you use any street drugs?
I never use that.
How is your appetite lately?
It's okay, it's normal.
Uh-huh. Do you have any problem with urination?
No, I don't have that problem.
How about bowel movement?
No problem with that.
Have you ever been hospitalized before?
No, I never.
Okay. And are you taking any medication on regular basis?
Yes, I take atenolol and Libitor and metformin.
Oh. Are you allergic to anything like medications, pollens?
No,
Great. What is your job?
I work for the financial company.
Okay. I'm going to do the physical examination on you, and everything I'm going to do, I will keep you informed. Okay?
Okay, doc.
Give me a second to wash my hand. Okay. I'm going to look into your eyes. Could you please look above? Okay, thank you. I'm going to palpate on your neck. Okay. And I'm going to listen to your neck, and then I will listen to your heart and your lungs. And I also need to untie your gown. Is that okay with you? Okay, take a deep breath. Great. One more time. Good job. Again, please. Great. Okay, let me listen to your neck, okay? Okay, thank you, Chok. Thank you, Mr. Rook, I mean. Okay, could you please lay down and I can examine your belly?
Okay.
I need to expose this a little bit. Is that okay with you? I'm gonna press on your belly. If you feel uncomfortable with any point, just let me know. Is that hurt?
No.
Okay, great. Okay, I'm done here. You may sit up. And I think I forgot to ask you some question, and it's very personal question. You might feel a little bit uncomfortable with this, but it might be a hidden clue to help us to diagnose your problem. How about your sexual life? Are you sexually active?
Yes, with my wife.
Do you use any protection?
No, We don't use any protections.
Okay, great, thank you. Now we are done with history taking and physical examination. From what you told me, you have a chest pain, which is like pressure.
Right.
Someone put the pressure on your chest, and I think there are some possibilities that might cause your problem, like heart problems or esophageal problem.
Do you think I might have a serious heart attack? Because my father, he died of heart attack last
Oh.
year.
Oh, are your parents still alive?
My father, he died of heart attack last year. My
Oh,
mom,
I'm so sorry to
she
hear that.
has diabetes. Do you think I have it?
Yeah, there is a one possibility is that you might have a heart attack, but we should run some more tests like blood test, EKG to monitor your heart working, and we might do some chest X-ray. And as soon as I got the lab result back, I can be more better to tell you about this.
Okay, thank you, doctor.
Is that okay with you?
It's okay.
Do you have any other concerns?
No.
Okay. Thank you so much, Mr. Brook. And I will be back as soon as the lab result came back.
Thank you.
Thank you, first of all. Now, what I would like for both of you to do, Quan, we'll start with you, critique how you felt like you did and talk about the things you felt like you did well and the things that you probably would like to do better.
Okay. May I speak in Thai? Okay.
I don't understand a word, but that's okay.
I will try to speak in English then. I think I missed some question, which is not very good. That is why you have to list before you enter the room. When you be there, it's like going to the space. You have no idea what is going here, and if you don't have anything to attach your thought with, then you will lose the point. But I think what I did right is I greet the patient by their name, introduce myself, and ask the open-ended questions.
I agree. I think you did a good job of trying to establish a relationship, a rapport with the patient. You made good eye contact. Now, I know that you felt like you missed some questions, but it's important to realize you went back. You went, oh yes, I need to follow up on these. And please, as Dr. Graham was saying, you guys aren't robots. Okay, you're not computers. So you may forget something, or you may fail to ask something. That's fine. You know, when you realize you need to ask it, you can go back. You can say, I'm sorry, I missed some valuable information. Can we talk about that now? So you really did a good job of that.
Thank you.
Do not feel uncomfortable when it's like, dadgummit, why didn't I ask that? Just don't skip a beat and say, okay, fine. Now, yes.
May I add
Sure.
some more? I think the major mistake that I've just made, I forgot to counseling patient about the smoking. Actually, I should ask him like, I'm concerned about your smoking habits. Have you ever thought to cut down on your smoke? We have some good stuff here to help you get through this. Just let me know when you are interested in quitting this habit.
Dr. Quan, I'm curious. When you're thinking back, you wish you would have done that. What stopped you from doing that during the exam? Do you remember?
What stopped me?
Why didn't you spend more time with the counseling about smoking with your patient? Did anything stop you, or did you choose not to focus on it?
Actually, when I had a real examination, I would take a note. I will make a little square in my note sheet, and before I went out of that room, I will look in my sheet, and that will remind me that I have to counseling with my patient. Actually, I did. Actually, I wrote the memorized in my board, but I forgot to look at it. So it's a major mistake.
Details.
Yeah,
Details.
it's details.
One of the things Dr. Graham and I talked a bit about was during your presentation, especially when it comes to smoking, that residents obviously and medical students are encouraged to counsel their patients when they find that they smoke. Now, the reality is, unfortunately, not enough doctors do that in our country for a variety of reasons, okay? Because sometimes I think what physicians experience is that they may counsel their patient, and their patient may smile and say, yes, doctor, but then go out and light up a cigarette, right? Okay, so I think it's important that you do that. At the same time, I think it's also important that if you, next time you see your patient again, you don't hit him over the head because he's not stopped smoking yet, okay? And you wouldn't do that, but it's, you know, there's some things that you can control, there's some things you can't.
Exactly. The other point which is very important is when you want to counsel your patient to do something, don't blame them. Don't say, this is just a very wrong habit. Because you just use your common sense. If someone blame on you, you would not feel comfortable with them, right? So just find your words. Find something that you think the patient will feel comfortable with that.
In that case, when you're talking about alcohol usage or overuse, smoking, drug usage, you can let them know that as the physician, as your physician, you feel that it's important that they consider either decreasing or stopping. Okay, it's better for their health, it's better for any number of things. Now, as the patient, what observations do you have?
For me, as I'm her SP, she did well. I let her pass these examinations.
Thank you.
She asked a lot of history and do all the history, all the physical examination that need in this case. As a SP, they have a checklist, like you do the OSCE or long case examination. This is the same system, like a checklist. So you have to know the checklist, like when the Thai say, when you know what the enemy think, you might win the test, something like that. And because you know today there's a lot of pressure. She do it last year, and so it's okay. Just forgot to say two things. Just nothing. Okay, good, really good.
Thank you.
One of the things I noticed was that Dr. Quan made good eye contact and worked to do that in a comfortable way.
Yes.
Is that what you experienced?
Yes, it's really good to make the eye contact with the patient, because when she make eye contact with me, when she told me that I'll work up and I'll concerns about you, I trust her that a doctor, she really concerned about me, and I need to do that workup like she said.
Good, thank you. Now, I'm wondering, are there any comments from you that observed? Anything you noticed, anything you'd like to ask about?
One thing that you might hear, you put down a list of things you wanted to ask, but also another way that helps you remember things you might have forgotten, like whether he had any trouble breathing or anything, was when you go through that focused physical exam, when you're listening to his lungs. Oh, I forgot the lung question. Then you can ask that at then. So that's a way to also remind yourself about things you should have asked and might have missed in your list.
Thank you,
Session.
Susan.
Anyone else? Please. Good. Now we will move to.
The second case.
So this is the who want to be a doctor. I know you know that first time is the hardest time of your life. So if you do it in this room, this is your first time. The hardest is today, and you make it. And if you gonna on this way, you can do in the real examination room. Okay. มีใครเป็น volunteer ป่ะครับ
ได้น้องขอวันทีค่ะ and in this case Dr. Susan will give us an honor to be our standardized patient.
I've just
Okay,
morphed
please
into a
clap your hands
yellow-eyed
for-
41-year-old man.
And let me remind you something. In this case, the patient came to see you because of abdominal pain and jaundice. But she doesn't have a yellow eyes right now. You just pretend that she really have it.
Just,
Good morning.
Good morning.
Sanchez. My name is Dr. Jai Kambai. Yeah, I'm from this hospital.
Okay.
Yeah. First, could you describe about your symptoms?
I've had belly pain. My belly hurts for about 4 days now.
4 days.
Yeah.
Uh-huh.
And my friend said my eyes were yellow.
Yellow.
Oh, see, my eyes are yellow. Can you see them?
It's a little bit,
little
yeah.
bit, yeah. So I figured, I didn't want to come in, but I figured 4 days, I better come in.
Uh-huh.
So-
You have a yellow.
Eyes, just a couple days, but my belly's been hurting for about 4 days. Yeah.
Uh-huh. It's about 4 days. Did you take any medicine?
No, I didn't know what to take. I don't take any medicines, so
Yeah.
I don't like to take medicines.
Oh,
So I didn't take anything. No.
Do you have any underlying disease?
No, not that anybody's told me. I think I'm pretty good. I drink some alcohol.
Oh,
But other than that,
What?
other than that,
No.
other than that.
Oh, yeah.
Okay.
Sorry, I'm from foreign. I'm
No.
from Thailand, yeah, so.
I will try to enunciate. Yes.
Uh-huh.
Yes.
So you check how frequency about alcohol?
Oh well, I've been drinking since I was 17, but I've been drinking quite a bit, since the last 10, 12 years.
How about the cigarette? Do you smoking?
Yes.
Or how often is how?
Oh, pack and a half a day, For
a day.
yeah.
Wow, it's a lot. So, so
It was less than I used to. It used to be 2 packs a day.
Uh-huh.
Yeah.
so 2 packs a day is a lot. So I think it maybe affect to your body. So maybe if you want to stop smoking, you can consult this hospital.
Yeah, but I'm here for my belly pain. What does that have to do with my smoking?
Oh, it's just only consulting.
I always wanted to ask that.
If you want to stop,
Oh.
can consult me. Yeah.
Okay.
I'm so sorry. This is your private secret. So can I ask about your sexual? or about your family history?
I have a girlfriend I lived with for years. We have a couple kids, but I just felt pretty rotten for the last 10 days or so. So we haven't had sex for about 10 days, but usually I just have it with her.
Did you use condom?
Hey, but we've been living together for 10 years. No condoms, you know.
Sorry. And how about your family? I want to know about they have any underlying disease?
Well, my dad died of cirrhosis. He was like only 56. And yeah, and I had somebody else in my family die of problems with AIDS just, gosh, a couple years ago. Yeah.
Okay.
Yeah.
So next, comfortable. Oh, go away. So next, please lay down. I will take your physical. Yeah.
Okay.
Before, I will wash my hand further.
Okay.
As a professional. It's not just.
It works.
Yeah,
That's
it's
right.
not right. Sorry. Maybe, yeah. Yeah. No, just that. Feel free, not free. Relax. First, we take off your glass. Oh, no, don't do that. Before, take off the glass. Look at above. You have
Pretty yellow, huh?
Yeah, you have pale. Is a little.
Little.
Yeah. Next, I will tell you. I will do about it. To, for example, do abdominal pain. Yeah. For first, sorry. Can I do it?
Yes, you can.
Yeah. Relax. If you pain, you tell me.
I will.
Yeah. Is you can?
No.
Yeah.
No.
Grab. Yes.
Maybe. A little bit.
Can you describe about this pen?
Well, it's sort of it's sort of there all the time, you know, and what do you call it? It's been getting not so much worse every day, but sort of about the same for about 4 days.
Oh, Is it colleague?
What does that mean? I don't know what colleague is.
Oh, how is frequency? One about how is frequency about the pen?
It stays about the same.
Yes, you can see that. Sorry, I'm just the initial. Now I will.
I probably wouldn't have belted you. Probably.
Yeah. Now I will check about the chest. I will listen your chest.
Okay.
Yeah. Deep. Next. Deep. Next. I don't know where. Okay. Next. Oh, sorry. Okay. Thank you. So, you have any question?
Well, you know, what are you going to do for my abdominal pain? What do you think?
I think. Oh no. I test for your abdominal pain because maybe you have symptoms about your GI tract, your gastrointestinal. Yeah. And focus about you have a alveoli quadrant. Maybe you have the symptoms about it. Gallbladder.
Oh. Okay, yeah,
Because,
well, you know,
because of your
my friends have had that.
Oh yeah. You have alcohol drinking. So
That could make me sick? Alcohol? Moi?
Oh shit. Thank you.
All right, well, thank you very much. That was most entertaining. And most enlightening, I think. All right, guys, come on up. Thank you. You did I thought you did a good job, and the patient did an excellent job.
I didn't make you too nervous.
No. Why don't we start off by you giving us a critique of what you think you did well and what you would like to do better next time.
I think better next time. This is not well. I forgot a lot of many things.
Did you feel comfortable though? I mean, did you feel pretty comfortable in the situation?
Yeah, I feel free. I feel comfortable because
Okay.
it's not have any pressure.
That's a good way to be. And you did not seem uncomfortable. You seemed like you knew what you were wanting to do. What I noticed was that you worked to make eye contact with the patient, and I thought that was good. There were maybe a couple of exclaiming in there that the patient might have gotten upset about. I can't think of exactly, but there was one or two, and I think you just have to be careful how you respond sometimes to the answers. That's all. But otherwise, I thought you did very well. Well,
Thank you.
hang on, hold on, not yet.
Oh, yeah.
Okay, my esteemed colleagues, what do you think?
You did great, but please don't use medical term like GI tract. The patient don't know what is GI tract. Just use only gut, bowels. It's okay. You have problem with your gut.
Okay.
Right, the gut and belly and stomach and all those things, but GI tract, probably not.
Also, okay, thank you.
Well, that's terrible. It's hard because I'm a doctor, right? So it's hard for you to remember that I'm not and all that. But yeah, and also part of it, you asked some questions and you didn't ask the secondary questions. You asked about the abdominal pain and about where it went, okay? But you didn't ask what it made it better or worse. And that just comes with practice, because all those classic things, shortness of breath and pain, you end up with little routines that you go through each time. And by the time you take this exam, you will have done that many times.
Mm-hmm.
So it will be natural for you, okay? Because you will have worked out a way to always remember to do that.
So, okay.
So the things you forget, you'll be no trouble by the time you get there.
Oh, thank you.
And you were very friendly, all right, and I could understand everything. Not the GI, because I was a patient.
Okay.
But you were very non-intrusive about my alcohol, okay? That you probably should have gotten much more of a history on how bad the alcohol was, because I wasn't going to give it to you, because I'm not an alcoholic just because I drink a 6-pack a day. No. So that's something, and it's in America, alcohol is big, so you'll have one alcohol patient guaranteed.
Yeah. Thank you.
But very good. It was
Oh,
fun.
yeah. Thank you.
First of all, I would like to thank you to be our volunteer, and you did a good job, really.
Okay.
But as we have, as Raf and Chok try to tell you many times that don't forget to drape the patient. See, you just sat on the drape. Yeah, and in the actual exam, it's like really like this. The drape is on your seat, so I recommend you to drape first. Then you won't forget to do it.
So I forget it. And I have a question. If in the middle of the time, yeah, I sat on it. Can I drop to the patient?
Sure.
If
Yeah, but especially when you want to do some abdominal examination, you have to expose it. Actually, when you want to listen to their heart and lungs, you have to open their gown. คือต้องตรวจตรงร่างกายเขาอะค่ะ เราจะไม่ตรวจข้ามเสื้อเนาะ แต่อันนี้คือเราสอบให้ดูเฉยๆ เพราะฉะนั้นถ้าน้องจะตรวจท้องน้องคงต้องห่ม ถึงนั่งไปแล้วก็ต้องหยิบขึ้นมา
มันจะไม่ได้คะแนนเขาไม่มีตัดคะแนนว่าโดนก้นไปแล้ว
And for those who've done it, this is a question because we did not have to do this when I went through this years ago. But if somebody comes in and they have like knee pain and they're in their street clothes, do they then undress and you have to drape everyone, or are you just going to do a pull up your leg? I mean, are there going to be some patients that you do not have to drape? Because it's just a procedural difference in the United States generally versus here. But will there be some cases where you don't have to drape?
Yeah, the telephone case, yeah, and might be that the father of children come to the clinic for the consultation, for the counseling, yeah. Their children at home has fever, something like that. Please don't drape this kind of patient because they are not a patient. They are the father of the patient, yeah. Of the patient.
Mostly, if they have some kind of intention that want you to do the physical examination, they will wear a patient gown.
Yeah, they will wear a gown.
So you can untie a gown easily and expose any part of the body easily.
So, please draft after introducing yourself. Yeah, just I mentioned you before. I'm Dr. Rat. I'm a physician in this hospital. First, let me cover you with this to make you feel more comfortable, and then ask, how can I help you today? So this way is very good because you won't forget to drape the patient.
Yeah. Thank you for the comment.
About the CS examination, do I have to undress the upper part?
Yes, you have to ungown the patient in the chest part. In this, you have to untie. And you have to undress the patient in the part that you want to do physical examination, and you have to cover the other part with that gown or the sheet that you drape them. Just expose only the part that you want to do physical examination.
As laced as possible, I would say that.
And do you have to tie it back?
Yeah, you have to retie the gown after you've done physical examination. You finish your examination.
What about a young female patient and your male doctor?
Oh, I think it's okay to ask the patient to untie her gown.
Do you need witness in the room? The third person?
But there are no first person in the CS in the clinical skill examination.
No, I mean in the clinical practice. I mean, they might uncheck your point. If probably it's not going to be on the CSA, right?
Yeah.
But just in clinical practice.
In clinical practice, we must have the third person with us to do female breast examination, I think.
In CS examination, there's some prohibit checklist.
You can do breast examination.
No breast examination.
No PV,
no rectal,
no
PV.
rectal, no PV.
So, and I think in CS examination, it's enough if you just ask for the oral consent. May I do this? May I do that?
And you can ask the female patient to loosen their bra. Yeah, if you want to listen to her heart and her lungs.
Any question?
Another question. So you have a checklist for each problem, like what you're supposed to do to get 100%. They gave you in the CS book?
Yeah, we have the materials, but we don't know it for sure whether the real checklist will be like this or not. But we try to follow the course of material that we have.
If you do PBL, correct? Small groups. By the time you get to do this exam, whether you be here or in Calgary or at Texas Tech, and I know that you see more different patients in a different way perhaps than other places do, and that's true all through the country, you will have seen many people with abdominal pain or with chest pain or with headache, all the classic symptoms. And on paper and with patients, I bet you will have gone through headache or chest pain dozens and dozens of times so that you will have the differential for chest pain. What do I do with chest pain? Is the esophagus, is the organs there? Abdominal pain, well, right lower quadrant pain is this. Left lower quadrant pain is that. So before you've ever touched a patient, there are books out all over the place about classical clinical symptoms and differentials for all of those classical clinical symptoms. So you will have done that many times. And the comment at the very beginning, trust yourself. If you have a good medical student and doing your stuff, you will have done this many, many times. All right? So your problem will be your English and being nervous because it's an exam, more than worrying about missing a differential, because you will know right upper quadrant pain is the liver and the gallbladder and the pancreas and maybe the heart, okay? You will have done that so many times. So practice, 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 and then it'll be a lot less scary. And practice your English in these things. Go through the abdominal pain with your friends with the English, okay? As you go through many, many times, as many times as you can.
Is there any volunteer here? ใครอยากจะซ้อมสัมภาษณ์ไหมคะ
Female physician, please. Do I have a right? Oh, okay. Okay, I'll first before I pick. What young lady physician would like to try? Please. Stand up. Who? I'll pick. Okay, very good. We have a volunteer. Thank you.
Thank you.
Let me very quickly run through while you make notes, mental notes. The patient today is Mr. David Innovis, a 52-year-old man. He presents to the clinic today complaining of blood in his urine. Vital signs are as follow: body temperature 98.6, pulse 75 per minute, blood pressure 120/70, respiratory rate 18 per minute. Examinee's task. Next 15 minutes, you are to take a focused history, et cetera, et cetera, et cetera. Okay. Are you ready?
Yes.
Okay, very good. Thank you.
Good morning, Mr. Enough. I am Dr. Noralak. I will be your attending physician for today.
Oh, hello, doctor. My name is Evans.
Evans.
Maybe it's a wrong record, maybe. Nice to meet you.
Nice to meet you.
Yes.
Okay. Okay, so let me drape you first.
Okay. Thank you, doctor.
Okay, so what symptoms bring you here today?
Oh, I'm so scared, doctor. This morning I saw blood in my urine.
For how many days have you had these symptoms?
It started yesterday. Last night I saw the blood in my urine. But first, I think that maybe it's from the beet salad that my wife made for me the night before. Yeah, so I didn't concern about that.
For how many times did you have blood in your urine?
Since
yesterday.
Yeah, since yesterday I had three times. Yes.
Okay. Have you experienced these symptoms before?
No, never.
Never. So this is your
Yes.
first time.
Oh yes, doctor.
Okay. Do you have any other symptoms?
I don't think so. Maybe I saw a blood clot in my urine also this morning. Yes.
Does the blood come before the urine, or come with the urine, or come after you have finished?
I didn't notice about that. I just saw the blood, all of blood in my urine.
Okay. Do you have difficulties when you urinate?
Oh no, doctor.
No. Do you have pain when you urinate?
No, that's fine.
Do
No
you
pain.
have abdominal pain?
No.
No. Do you have fever?
No.
No.
Mm-hmm.
Okay. No. Okay. Okay. Let me ask you some of your social history. Do you smoke?
Yes, I smoke 1.5 pack a day.
For how many years?
25 years.
25 years.
Yes.
So do you drink alcohol?
On the weekend with my friends, I enjoy drinking just a single glass of Scotch whiskey.
Okay, so not
Yes.
not every day.
Not every day.
Okay, so and do you use street drugs?
No, never.
No. Okay. Do you have any underlying diseases before?
No, I had appendicitis when I was 25 years old.
25.
That's it.
Okay. Are you allergic to any medicine before?
No.
No. Okay. Okay. Let me ask you some of your
Okay, doctor.
personal
Okay.
questions.
Okay.
Okay. I want to ask you about your sexual activity. Do you have it regularly, or do you have any kind of protection?
Is it necessary for the diagnosis?
It might be helpful. Would you be comfortable to answer me?
Okay, I'm sexually
If you
active.
may,
Yeah. I mean, every other day I have sex with my wife.
Okay, so do you have any kind of protection?
Just sometimes because I would like to have a baby with my wife soon. Yes.
Okay. Okay, so now let me do some physical examination. Okay.
Okay, doctor.
Do you have any problem? It seems that you're.
Am I going to be fine?
Okay. Now I still don't know exactly what your condition is. Okay, I'll have to complete the physical examination, and then we'll do some laboratory tests, and then after we got the lab test, I will inform you later. Okay. So now just let me do the physical exam first. Okay.
Okay.
Okay. So let me wash my hand first. Okay, so can you take off your glass, please?
Okay.
Okay, thank you. I will just look at your eyes, okay? Okay, please look above. Okay, and look below, please. Okay. So now I will palpate your neck, okay? Okay, now let me listen to your heart and lung, okay? Okay, please take a deep breath. Okay, that's great. Again, please. Okay. A deep breath, please. Again, please. Okay, that's great. Okay, so now let me examine your abdomen, okay? Can you lie down, please?
Okay.
Okay, now I will press on your abdomen. If you have tender anywhere, just let me know, okay?
Okay.
Does it hurt?
No. Doesn't hurt.
No, it doesn't hurt, right?
Yes, that's fine.
Okay, so that's great. Now you can sit up.
Okay.
Okay, now I will punch at your back, and if you have any tender, just let me know, okay?
Okay.
Does it hurt here?
No, doctor.
No. Here?
No, that's fine, doctor.
No. Okay. So.
So do I have a cancer?
Okay, as I tell you, I still don't have the confirmed diagnosis yet. So maybe we need to do further investigation. Okay, for now, I think you might have several conditions that I think of. First of all, you might have an acute cystitis, that is your urinary bladder will get infection. Okay, or you could probably have a urinary tract stone. Okay, okay, so we just have to do some urine exam first. Okay.
Okay.
Okay, and just now that I talked to you, you said that you smoke, right? Okay, I'm kind of concerned about that. Okay, since I think everybody knows smoking is not good to your health.
Yes, I try many times to quit it, but I cannot. Do you think I'm a loser or something?
No, you're not a loser. Okay.
No? Yes.
Yeah, I know stop smoking is very difficult, but our hospital, we have a very good smoking cessation program.
Okay.
Okay, if you are really interested in stop smoking, I think you should join this program.
Oh, thank you. I very appreciate your help.
Okay, so do you have any other question, any concern?
Can I call my wife because my wife very concerned about my health this time too. Can you help me because I didn't bring my phone yet. Okay, maybe that's fine. I will find the phone by myself. Thank you, doctor.
Oh, I just forget something. Do you take any medication regularly?
No, doctor.
Okay, no. Okay, so do you have any other questions?
2 weeks ago, I ran into the city marathon, and I think I'm healthy that time, but I just curious that is that the cause of the blood in my urine this time? The running in the marathon?
Running in the marathon?
Yes.
Do you have like muscle pain or?
I have muscle pain just a few days after the marathon, but now that's fine.
Okay, so I think we just need to do some more exam and then I will tell you later, okay?
Okay. Okay, thank you, doctor.
Okay. I'm done. Okay, so if I have the confirmed diagnosis, I will tell you. Okay.
Okay.
Goodbye.
Okay.
Very good. All right. How do you feel like you did?
I think I'm too nervous.
You didn't present all that nervous, but you felt nervous. How?
I feel nervous.
And when did you feel most nervous? Was it in asking questions or not knowing what to do?
Yeah, in not knowing what to do.
Right, and I noticed a little bit then, but I think that was very minimal. You covered very well. And I think the patient presented an interesting, sometimes, dilemma, because near the end of the exam, he said, oh, by the way, I ran in a marathon not too long ago, okay? And sometimes patients will give you information, maybe very important information, kind of as the last thing. It's called, in my world, it's called, oh, by the way, information. It turns out to be pretty important. And they may not have let you know that, and it could sometimes change then what you might want to do. I think you made a good eye contact. You draped him quickly, which was good. From your perspective, what did you experience?
From my perspective, I appreciate this doctor because she looks concerned about my concern, really. Yes.
She took you seriously.
Yeah, took me seriously, and I think she did very well. But sometimes the doctor, the examiner should be careful is the hidden history that you didn't ask. Like this patient has a weak stream of urine. Maybe first time you may ask that do you have any problems, urination? Maybe the patient, in the standardized patient, will say no. But if you ask them specifically that, do you have any problem with your stream of urine, they may tell you sometimes.
Sometimes it's okay to ask like a leading questions.
Sure.
Oh,
Yeah,
yes.
sure it is. Specifically when you have, it's like you're following a path. And especially with his presentation, there are probably some very specific questions you might want to ask. And you can do that. Anything else?
No, I think she did great.
No, I thought she did very well as well. Any observations from you guys? Or any questions at all? Because oh yes.
As you said before, if we forget some questions, will the SP will like bring out the by the way clues like this?
It's possible. I don't know. I'm not sure what an SP is told they can do it.
I think sometimes the open-end question at nearly the end of the interview, like, do you have anything else you think it's important to tell me that I didn't ask? Maybe some nice patient will tell you, yes.
And you make a good point. The open-ended question near the end, trying to get any more information that might be helpful. And I do know that standardized patients will respond at that point. If you use an open-ended question and if you, at the end, go, is there anything further I need to know? And I think that's almost always important to ask. So, good question.
Yeah,
All
from my experience, open-end question at the end of the history taking is okay because you should ask, okay, I think I have got enough information from you. Is there anything else you think I should know about your symptoms? And sometimes the patient might, oh doctor, I also have a chest pain, and you don't forget, you forgot to ask. Oh my God, okay, so now you have to ask the chest pain questions. Yes. It's really helpful, so you should ask this. Yeah.
And the things that this patient have very nervous and agitation, and you have to realize and ask the patient that, oh, you look to your watch many times. Do you rush or hurry to go anywhere, anything? And also the wife that he mentioned, he wants to call his wife. You should express to help, like, okay, our office have a nurse to administrate this problem, so I will arrange for you to call your wife. That's the communication and interpersonal skills you should respond.
I think that's an excellent point. When you are sensing even nervousness or fear or anxiety, especially at one point you said, do you think I have cancer? It's like, am I going to die, basically, is what they're asking. What you should do is reassure them that although you may not have all the information to make an accurate diagnosis, that you're going to do everything you can to find out as quickly as you can. And one of the things that you said initially was that she made you feel comfortable, and she took you seriously. And that's very important, I think, to always take the patient seriously, even if you're going, God, what's this about? So remember that. And the question about, can I call my wife? Another sign of nervousness, and so you can, it's important that you say, we will make sure that your wife is contacted and that she has all the information as soon as we know exactly what we're dealing with. Quan, did you have something?
Well, I think we have two chances to ask the open-end question. On the first encounter, after they told you about the shift complaint, you may ask, could you please explain more about this? So this is your first chance. And the second chance is when you are going to leave and you ask the question like Brad recommend. May I give you a little comment? I think underlying disease is not right choice of words that you should use. Which one that you recommend? How about, do you have any other medical conditions?
It's good.
Underlying disease, they may not know that if you have any underlying conditions. And also, I'm sure you ask about surgery, but make sure you do. Any other conditions I need to know about? Are you undergoing any kind of medical care now? Have you recently had any kind of surgery? Those kinds of questions are important to ask.
Very good job.
พี่ไม่อยากใจร้ายเลยอะใครอยากจะวอลันเทียออกมาเป็นหมอไหมคะ ใครสนใจอยากลองซ้อมดูไหมเอ่ย
เดี๋ยวเคสสุดท้ายก็จะมี SP จากในฟอร์นะครับคือเป็นแบบเพิ่งให้น้องเขาดูสคริปต์นิดเดียวแล้วก็เดี๋ยวจะขอวอลันเทียอีกทีนึงครับเพราะว่าคือ SP ที่เตรียมมากับคือจริงๆพวกนี้คือเป็นหลักการว่าเราจะไปสอบเราก็ต้องสลับกันเป็น SP สลับกันเป็นหมอนะครับเพราะว่าอย่างนี้ก็คือแบบเป็นหลักการซ้อมคือพี่ก็เตรียมน้องในฟลอร์เนี่ยมาเป็น SP เคสหนึ่งละแล้วก็เดี๋ยวจะขอน้องในฟลอร์อีกคนหนึ่งมาเป็นคุณหมอนะครับคิดว่าน่าจะได้นะเห็นตัวอย่างมาแล้ว2เคสมีใครอยากลองไหมครับ
ไม่งั้นเดี๋ยวพี่จะเชิญนะ
นี่ครับเราได้คน
ฮัลโหลมาแล้วครับ
All right, the patient is ready. It looks like the physician is just about ready. Let me review the facts real quickly. Oh yes. This is Mr. Andrew Litt. He's a 27-year-old man, and he presents to our clinic today complaining of the worst headache in his life. Vital signs are his temperature is 99.8, pulse of 95, blood pressure is 160/90, respiratory rate is 14 per minute. All right, if you are ready, we will begin.
Hello, my name is Dr. Batan. Hello, Mr. Litt. I am your physician. I'm going to look after you today.
Hello, doctor.
Nice to meet you.
Nice to meet you.
Okay. Okay, let's make a conversation. What's bring you here today?
Oh, doctor, I'm having the worst headache in my life. I've never experienced anything like this before. The worst one.
What is it like? Is it a sharp pain? Like a which side of your head is the most pain?
Which side? Everywhere. Everywhere. It's all over my head. But my eyes are the worst. My eyes.
Have you traveled with this problem before?
Actually, I'm having migraine from time to time, but I know this is not migraine. I live with migraine for my life, but this is the worst.
I see. So how long have you had this symptom before? And
3 to 4 days.
3 or 4 days. That is getting worse, or that is it getting better? Have you taken any medication before you came here?
It persists every day, and it got worse. It worse and worse and worse.
Worse. Is it getting better in the evening, or is very worse after you wake up?
It is almost all the time. all the time. But when I sleep, it's a little bit better. But once I wake up, it comes back again.
Oh, you feel more painful when you wake up?
It's all day. It's all day, all the time, all day.
Oh, did you take any painkiller before you came here?
I take paracetamol.
Is it work?
Just like every time I have migraine, but it's stupid. It doesn't work at all.
Okay, so do you have any other problem that you bring you came here besides this headache? Like you feel weak?
Yeah, I feel weak. I feel fatigued. I'm not sure if I'm having fever or not, but I feel really fatigued right now.
Do you have any other medical condition? Because today we have just measured your blood pressure is a bit high. Normally it should not be exceed 140 over 90, and now it's quite high. So
yes, I'm having a high blood pressure and migraine for many years, and I'm taking I'm not sure atenolol something once a day.
Once a day, do you forget to take the medication?
No, I take it every day.
You take
this
it
morning,
every day?
just this morning, I took one.
Oh, I see. So maybe we have to talk about we have to adjust the dose of your antihypertensive. Okay, so I'm going to make your examination. Please lie down so I can put the graph in.
Do I have to take my shoes off?
Oh, it's okay.
Is that done?
Oh, excuse me, I forgot to take my thyroid drug. Okay, make it most comfortable as you can. So
thank you.
It doesn't work, it's okay.
Oh, okay. Your hands are clean.
Okay, please take out your glass, please. And stay. Please look up. Thank you. And please stare down. Thank you very much. You seem so okay. Your eyes okay. I'm going to touch your neck. Okay, that's great. I'm going to listen to your heart and your lung. Okay, please take a deep breath, please. Okay. All right. So next, I'm going to make a urinary examination. Please, if there is any uncomfortable, please tell me.
All right.
Okay. So now, I'm going to test your your strength. Please resist as I do. Okay.
Okay.
Okay. Please flex your hand. Please.
Flex. Okay.
Oh, you have very strong. Okay. So make the other one, please. Oh, great.
Well, doctor, I'm having a severe headache right now. Do you have any painkiller, something to give to me?
It seems that we have to make the very definite diagnosis before we can give you medication, because maybe it make you worse.
Okay.
Okay. And then could you please rise up your leg, please? Okay. Resist it.
Resist?
Oh, awesome. Make another one, please. Okay. So I would like to ask you to please sit down.
Sit down.
Okay. So the next thing is I'm going to close your eye and you have to resist it. I'm going to open your eye and you have to resist it, okay? Okay. Great, very handsome. Oh, just kidding.
I know that.
Please make a bow like this. Okay, show your teeth, please. Okay, clench it as you. Okay, And then
My neck hurts. My neck hurts.
you hurt your neck.
Yeah, it hurts.
Which is the most painful side?
Honestly, it's everywhere, but my neck too. My neck too. I'm not sure about
Is
that.
it come like a band like?
And like?
Band like a rope?
No, but I can hardly move my neck. I don't know.
Oh, I see. Could you please tell me if it's hurt, okay? Are there any painful side
Oh, no,
like
no.
this?
No.
Have you ever been to a Thai massage before?
No.
Okay. As an exam, your name is quite okay. Maybe I'm going to take you like it's called reflex. It can give a clue for your neck pain.
All right.
Okay.
All right.
Okay. Please place your hand down. Oh, great. Make another bite, please. Okay. Do you have any other questions to ask me more? Any other concern? Like, do you have?
I have some concern that my daughter, who is now 4 years old, he got flu. I'm not sure, some kind of flu, and a running nose and a fever last week. She's now fine, not dead, she's fine. But I wonder if there's anything to do with my symptom, my headache.
Oh, just maybe because it's take about the onset is okay. It means after you have the infection from your daughter, it can come like this. But today, as I have seen your profile, the temperature is not so not too high. So maybe I have to say a little bit for your concern. Is it the light? Okay, very small light. Please open your mouth, please. Okay, tip your tongue outside and say ah. Okay, great. Your father is not inject. It means there is only mild inflammation. So as I mentioned before, now your diagnosis may be just a neck strain because there's no other sign that show you have a neurological deficiency. Don't you understand what I say?
Yes, I understand that, but no, nothing personal, Doc. But this headache is the worst in my life.
Okay.
I don't know where to go anymore.
Okay. Maybe I have to go to line. I need a further investigation because as your age is like quite a teen.
I'm 27, I'm strong.
I see, but your blood pressure is quite high. That is normally it should not be found in the normal people.
Yeah.
Okay, so anything? Do you take any? Oh, okay. Do you have any other medical condition besides your hypertension?
No, just migraine and hypertension.
Do you smoke?
No, never smoke.
Never smoke.
I drink occasionally, but with my wife.
With your wife?
Yeah.
Only one wife?
Yes, one wife.
Okay.
For now.
Okay. So I would like to send you to have a further investigation like a CT scan because you complain as the worst headache of your life. Okay. Just forget the next day.
Thank you.
Okay.
Very much for that comic relief. Very, very good. All right. Now, yeah, what would you like to offer as a critique of your physicianing? Oops, there it is.
I'm also getting very nervous. So, as I have seen the equations,
Yeah.
I didn't make many diagnoses before,
Okay.
like a differential diagnosis. So that's why I missed some tests, some special tests.
Okay.
Like maybe just my friends give the clue to me, like a stiff neck.
Yeah.
But okay, but this problem is quite like a remarkable because he said the worst headache in his life. So I am lucky that I didn't forget to to send for a CT scan, maybe, which is give maybe more clue about the disease.
Not only maybe it would give more information, valuable information, but it also, I think one of the things that I felt was that you were going, but doctor, you're not either hearing me or you're not taking it seriously enough. And so by telling him that we're going to continue to explore all of it, then hopefully you could relieve some of his fears or concerns, and help him understand that you really are wanting to find out what's going on with him. Yeah. You have a good way about working with the patient, even though sometimes he's a little bit challenging. What would you like to offer?
He is very good at speaking and concerning, but was this his first time, so it's alright to miss someone. If
Sure.
it was me, I would miss even more than that. Everything else, it's fine, just forget some parts.
Any comments or questions? I know this is near the end of the day, but hey, we're coming to the home stretch, right? This has been great, actually, wonderful. Thank you very much for finishing up the conference for us. Dr. Somkid? Oh, I'm sorry, yes. Would you like to add something to that? Joe?
You did well, but I think you should summarize the patient condition after the physical examination. Yeah, to make sure that you understand the patient symptoms. Yeah, and after that you should give the patient the workup plan, something, right? So we need to run some tests, including blood test, chest X-ray, or CAT scan of the head. Yeah, something like that. Yeah, and you have to give counseling to the patient because you smoke, right? Or you drink? Okay, about alcohol, something like that. Yeah, but everything is good. Yeah.
This is your first time, so you did well. In this case, this is for him. He's very good SP. This is his first time to be the SP too. I just gave him some sheet to like a checklist for him, and he did very well. And you is a good doctor also. In this case, like Dr. Lat say, I know that you might feel nervous because this is your first time and there is a lot of people. This is to improve your skill in this case. Practice more the keyword. Just that, everything is okay for me.
Thank you.
Thank you, Dr. Paul, Dr. Susan, Dr. Rat, Dr. Chok, Dr. Quan, and all of volunteers. And today is the final day of USMLE Workshop 2009. I would like to invite Dr. Somkit Sinorodom to give a closing remark.
พูดภาษาไทยแล้วกันนะ5 วันมันก็ยาวนานแต่ว่าบางแห่งก็บอกว่ามันก็ไม่จำเป็นจะต้องทำเด็กทุกคนสามารถไปสตัดดี้กันเองได้ก็ผมถามหน่อยว่าเป็นไงฮะ5 วันอย่างที่ทำวันเนี้ยคุณไปที่ไหนเขาก็ไม่ซ้อมเราขนาดนี้จริงเปล่าเพราะฉะนั้นถ้าอยู่จะทำอย่างนี้อยู่กลับไปหอเนี่ยก็ไปเตรียมกันเองได้ระหว่างเพื่อนฝูงแต่ก็คือควร1ก็ควรจะสอบก่อนเตรียมตัวสอบไม่ว่าคุณอยู่ในระดับไหนการเตรียมตัวทดสอบนี้มีความสำคัญก็เหมือนหมอรัฐพูดเนี่ยว่าจะซื้อหนังสือหรือไงก็ข้อมูลมีอยู่แล้วเพราะฉะนั้นก็ตั้งเป็นทีอย่างหมอรัฐเนี่ยเขา3 คน3 กษัตริย์หรืออะไรนะเรียกอะไรนะ3 คนอยู่ปองวุฒิโชคก็เขาช่วยกันแล้วก็เตรียมกันคิดกันแล้วก็แบ่งภาคคุณดูแชปนี้ผมดูแชปมันก็ทำให้ได้มีผลเพราะการสอบไม่ใช่ว่าเราแข่งระหว่างคนไทยด้วยกันเพราะฉะนั้นอย่าไปเซลฟิชคุณเอาข้อมูลกลับไปสงขลาไปที่ไหนก็ได้กรุงเทพที่ไหนก็ได้ก็พยายามหาเพื่อนมาศึกษาด้วยกันเพื่อต่างคนก็ควรจะมีสิทธิ์สอบนะครับถ้าสอบได้ไปก็ดีสิเพราะว่าลองดูผมเป็นตัวอย่างก็แล้วกันว่าเนี่ยผมไปตั้งแต่ปี1968ถ้าผมอยู่นี่ในเมืองไทย1968ตรงตื่นตรงนี้คุณจะไม่เห็นผมเหมือนอย่างนี้จริงเปล่า It make the whole lot different like overseas I'm not saying that all of you have to go or will go but if you go you come back to Thailand ก็ช่วยประเทศชาติช่วยการศึกษาแพทย์ได้มากขึ้นในระยะ10 ปี20 ปีข้างหน้าเพราะว่าประเทศไทยเราก็ยังต้องการมันสมองมากเคยคิดไหมว่าประเทศสวิตเซอร์แลนด์เนี่ยเล็กนิดเดียววันนี้คุณกินกาแฟเนี่ยอะไร Nescafe อยู่กิน Nescafe อยู่กินนมก็สวิตวัคซีนฟลูวัคซีนสวิตAtomic Smasher สวิตเซอร์แลนด์ประเทศกระจอกนิดเดียวทำไมเขามีเป็นใหญ่เป็นโตลองดูสิงคโปร์สิฮะสิงคโปร์มีไฮเทคมี Stem Cell Research เป็นเมืองท่ามีสิงคโปร์แอร์ไลน์แอดวานซ์จริงอยู่ทุนเล็กเมืองจีนเนี่ยมิลเลนแนร์จริงเปล่าเมืองจีนนี่รวยมากในระยะ20 กว่าปีที่ผ่านมาเมืองจีนส่งคนไปดูงานที่สิงคโปร์เมื่อ20 กว่าปีที่แล้วว่าทำไมสิงคโปร์ success เอากลับมาถึงเมืองจีนเปลี่ยนจากระบบคอมมิวนิสต์แต่ไม่ประกาศนะขอรัฐบาลอเมริกันส่งคนจากเมืองจีนไปอเมริกา 40,000 คนทุกอย่างทั้งวิศวะหมอทั้งกสิกรรมอะไรกลับมาThailand we need to do the same but what is the problem in Thailand in fighting no policy no continuity จริงเปล่าทุกวันก็ยังแบ่งเสื้อเหลืองเสื้อสีแดงคุณลองฟังอภิปรายในรัฐสภามันไม่ใช่อภิปรายเพื่อให้ประเทศชาติก้าวหน้าเพราะนั้นผมก็อยากให้คุณเนี่ยถึงนั่งอยู่เนี่ยคิดถึงการศึกษาแพทย์ของประเทศของเชียงใหม่ของอะไรก็ได้ที่อยู่ว่าประเทศชาติยังต้องการคนประเทศไทยก็ยังต้องการ specialist เพราะว่าคุณไปเนี่ยไปเทรน3 ปี6 ปีกลับมาเป็นผู้เชี่ยวชาญเนี่ยอยู่สามารถทำผลประโยชน์ให้ประเทศอุทิศการสอนการศึกษาการรักษาคนไข้เพื่อเป็น specialist ข้อเสียของเมืองไทยคืออายุ 60 ก็ forced retirement ผมปีนี้ 60 กว่าแล้ว จริงอยู่ผมก็อาจจะทำแบบสมัยเมื่อ 20-30 ปีที่แล้วไม่ได้คือหนึ่งอยู่เว้นทุกวันคนไข้ตัวเขียวมาผมทำ cardiac cath ได้ตลอดคนไข้หลังผ่าตัดผมจะ intubate extubate แต่มันก็ไม่จำเป็นผมสามารถกลับมาช่วยให้พวกเราไปอะไรเงี้ยมันก็มีผลประโยชน์เพราะว่าอย่างที่ผมบอกเนี่ยใช้เงินน้อยที่สุดแต่สามารถ educate คนตั้ง100-200-300แล้วให้พวกคุณเนี่ยมีสิทธิสอบและมีโอกาสไปเมืองนอกโดยไม่ต้องใช้เงินของคณะเลยจริงเปล่าไปถึงนู่นก็คุณมีเงินเดือนมีสวัสดิการเจ็บไข้ได้ป่วยก็ยังเขาดูแลรักษาเพราะคุณเป็นคนของเขาอยู่ในโปรแกรมเขาจะรักษาดูแลให้อยู่ stimulate ให้อยู่สอบและมีสิทธิสอบบอร์ดกลับมาเป็นผู้เชี่ยวชาญจริงอยู่เอาทุนของแผนกหรือโรงเรียนแพทย์ของคุณเองไปดูงานคุณได้หลาย certificate แล้วผมก็พูดแล้วว่าอยู่ไม่มีสิทธิ์ดูคนไข้ไม่มีสิทธิ์แตะคนไข้ไม่มีสิทธิ์เข้าไปผ่าตัดหรือทำ procedure ซึ่งไม่ได้มีความหมายคุณไป1 ปี 2 ปีใช้เงินต้องเป็นล้านเพราะนั้นผมไม่โปรโมทให้คนของเราคิดว่าไปดูงานในเฉพาะฟิล์มหมอดูงานทำไม่ได้มีใครสักเจนหรือถามไงว่าถ้าเที่ยวหน้าจะทำอาจเขาจะ modify แต่ผมจะให้ young generation พวกนี้มาช่วยกันทำเชิญถามมาสัก2 คำถามไม่มีใครอยากถาม
ขออนุญาตนิดนึงนะคะ
เชิญเลยครับ
น้องคะคือปีที่แล้วนะอย่างพี่โชคพี่รัฐอะไรเงี้ยกว่าจะได้เจออาจารย์คือต้องไปหาถึงอเมริกาตอนนี้อาจารย์เปิดโอกาสดีให้น้องๆมาพบแล้วอะค่ะถ้ามีปัญหาสงสัยอะไรพี่แนะนำว่าถามเลยฝากเนื้อฝากตัว whatever
ไม่มีใครกล้าถามเพื่อรอออกไปแล้วก็ถามกันใหญ่โอเคอีกอันหนึ่งประเทศชาติทั่วโลกเดี๋ยวนี้ communication อินเทอร์เน็ตติดต่ออินเทอร์เน็ตเพราะผมปล่อยอีเมล address อะไรแล้วคุณติดต่อมาทางอินเทอร์เน็ตตอบกลับทันทีหรือว่าวัน2 วันจะช่วยเหลืออะไรผมก็ช่วยลิงก์ให้หรือพวกรุ่นพี่รุ่นเพื่อนก็ลิงก์กันได้คุณมาจากไหนเชียงใหม่โอเคเชียงใหม่มีใครมาจากแถวอีสานไหมมีไหมไม่มีเลยว่าโอเคเขาอาจจะกลับไปกันหมดแล้วมีแต่ปักใต้ก็ดีแล้วนะเพราะว่าทุกอย่างก็ช่วยกันไปผมกำลังพูดรอคณะบดีไปคณะบดีกำลังมาพูดผิดจะพูดอะไรหน่อยไหมไม่กล้าพูด